I'm going to share with you one highly effective exercise that resolved my hip popping, my knee popping, and some of my knee pain literally in one day. To determine if you should be doing this exercise either on your right side or your left is going to come down to these three test assessments that we're going to be doing together. Now, the first one is a straight leg raise. If your straight leg raise is better on your right side, this is one of the three indicators that you should be performing this on your right side. If your pelvis rotation is better to the right compared to the left, this is also an indicator that you should be performing this on the right side. However, for this third one, if your hip abduction is better on your left side compared to your right, that is also an indicator that you should be doing this on your right side. Now, if 2 out of those 3 matched up or 3 out of the 3 matched up, you should be doing this on your right side. If it's the inverse, then you're going to be performing this on the left. Generally, if you are right lateralized, at least 2 out of those 3 are going to be better on your right side than your left, meaning more weight is shifted to your right and you're turned more to that right side. Now, I had some anterior hip popping and my knee was popping, and I tried different exercises to see what actually helped, and this one variation of a split squat made the biggest difference. And essentially what I really needed to create was more hip abduction, hip external rotation paired with femoral internal rotation all the way down the line. Now let's think of the knee joint for a second. If we have too much internal rotation of the thigh bone, the femur, and too much external rotation of your tibia, your shin bone, then they're not going to be able to articulate that well. And this is where a lot of knee problems can happen. However, if we can address the hip so that it is working in more external rotation paired with the proper mechanics down the chain, I found that this resolved both the hip and the knee popping literally in 3 sets in one day. Now, before I show you this variation of a split squat, I want us to decompress our TFL and hip flexor area. And the reason why is because when we're shifted to the right, we have more internal rotation at the hip, and the TFL muscle can act as a hip flexor and a hip internal rotator, but we want to be able to decompress that to allow it to let go. So then when we are training more hip abduction and hip external rotation, we're more effective at doing this. So all you're gonna need is your block from block therapy or a tightly rolled up towel, and we're just gonna spend a few minutes releasing that area. Grab your tightly rolled up towel or your block, and let's have this positioned just below this bone here on your pelvis. This is your ASIS bone. We're gonna have it just below and about 45 degrees to the right. So we're a little bit more on that outside portion of the hip. Now, I'm gonna be using my block and I'm gonna have the block on its side. So I'm going to locate that area and then just turn at about 45 degree, and now I am right on the TFL. And this can be a pretty intense area to work, but we want this to release because it can really pull the pelvis forwards into more flexion and internal rotation. It takes on way too much work than it actually needs to, but we want to let this release so then we can more effectively start pushing out of that side into hip abduction so that we can address the hip and the knee simultaneously and even eliminate some popping or some pain. Now, as I'm here, I'm gonna be breathing through my diaphragm. So I'm gonna exhale fully, bring those low ribs down, tongue to the roof of the mouth. As I inhale, I'm gonna feel my entire rib cage start to expand. And that is so important that we're triggering more of a parasympathetic state to allow our tissue to decompress and release. Now, this is an awesome position. People who experience hip pain, this is a great position to do, but I love to teach people how to re-educate the body on how to now move and own the space that we're creating. So once you're here and you've settled in, you can slowly surge more towards the front or towards the back. If it's too painful and you can't breathe in a controlled or relaxed way, ease off and reconnect at a less intensity. We don't want to be forceful. Every time I try to force something, it just doesn't work, especially with doing block therapy and fascia decompression. So once we've spent about 3 to 5 minutes here, you're nice and slowly going to exhale up and off. And now we're gonna jump into that one exercise I was talking about that made such a drastic change. So for this exercise, all we're gonna need is a cable machine. If you don't have access to a cable machine, you can use a band that you can connect onto something relatively low. And as I mentioned, this is gonna be a version of a split squat. And if we can execute this properly, we are going to bring our body into significantly more balance. Now, I am gonna show you the right side, but I'm gonna show you what to do on your left side as well so we can train both sides, especially if we are more shifted to the right and twisted to the right. Now, I'm gonna have the cable low, meaning it's gonna be on its lowest setting. And I am now training that right side. So I had the right hip pop and the right knee click and popping pretty much at the same time. But whenever I would do a split squat with a dumbbell, that's when I felt too much popping. So my theory here was the cable is pulling me forwards. This is gonna bring me more back and find my heel. But now I'm in more control so that if I do a specific load, meaning if I have the load in my left arm and my right leg is forwards, what does this make me do? Well, first of all, it makes me find my heel a little bit more, but it also makes me turn more to the left because it's pulling me to the right. If it's pulling me to the right, my body has to pull to the left. So as I come into a split squat and I'm trying to create more hip abduction, this is what this exercise is doing. And you should feel, as I walk you through this, a lot of the lower right portion of your glute is really starting to turn on and activate. And this was something that I was missing. Now, make sure that you follow this one step at a time and really pay attention to the cues. So here we go. I'm gonna have the weight in my left hand. I'm working on my right side. Now again, if you do the measurements and more were on the left, you're just gonna do the opposite. So this is gonna be on the other side. So my right leg is forwards. My left hand is gripped on. I'm bringing my body into that stack, meaning my diaphragm is over my pelvis. I don't want my pelvis to be too far forwards or backwards. Find that neutral point like this. Now, as I'm here, I'm going to inhale nice and slow, and I'm just dropping myself down like this. I am making sure that I'm feeling the ball of the big toe, the inner heel, and the fifth metatarsal head. I'm not losing any contact while doing this, but you're gonna feel more weight as you push through your heel, which is normal. So we're gonna inhale and just drop down like this, but this is really important now. As we exhale, I want you to feel that your pelvis and your hip is coming forward slightly, but also rotating slightly to the left. Now, I don't want you to over exaggerate and do this. We don't want to create too much external rotation demands in the hip. We just want to do enough so that we're training how to push out of that one side. So this is what a repetition will look like. Inhale on the way down. I'm going to be feeling more heel. Then as I exhale, I'm feeling my glute really working and pushing as I just slightly turn to the left like this. This is naturally going to happen because your body is needing to turn more to the left. So inhale down, exhale, feel the pelvis coming forwards, and make sure you don't lock the knee out too soon and then bring the pelvis forwards. Think the hip and the pelvis is coming up first, and then once you hit about this point, they're gonna be coming up together. So now, if I am to train this on the left side, I'm gonna actually have the weight in the exact same spot. Because if I need more external rotation on the right side, that means I need more internal rotation on the left. So if I have my left leg forwards, all we're gonna do is have the weight in my left arm, because that's gonna still wanna pull me to the left and create more internal rotation. So the exact same thing, lowering down, exhale, I'm pushing up, and this is gonna force me to turn a little bit more to the left, creating more internal rotation demands on that left side. Now you should have a better understanding as to why we are doing these exercises to help with hip and even knee pain, or just that popping noise that tends to happen. This is why if we are shifted to that right side, we want to be able to teach ourselves how to shift into the other side. That was the external rotation. And then with the left side, we were teaching ourselves how to more effectively shift into. So that wraps up this video. For the routine to follow, you started off with the block position in that TFL area. Spent about 3 to 5 minutes there. And then we're working in that split squat variation. When you're doing it on the right side or even both sides, you're gonna do about 8 to 10 repetitions and do 2 to 3 sets. And you can alternate from the right side to the left and back and forth again. So I hope you enjoyed this video. I'll see you in the next one.